When Emily was 17, her school principal asked her if she was harming herself after seeing cuts on her arm, assuming that she had a mental health issue. She went along with that assumption, as she was scared to reveal the truth. She was battling an opioid use disorder. She abhorred her lifestyle and wanted to change, but in that particular moment, she felt that she really didn't know what to do to control her life. Her friends witnessed her downhill struggle and wanted to prevent her from excessive drug use, but did not quite know how to assist or even approach her. It was only after Emily witnessed an older woman's life being taken away due to drug overdose did she ultimately decide to enter recovery and turn her life back around. Now she is a certified recovery specialist for Lehigh County and one of the organizers of a community outreach program for substance use disorders in the Lehigh Valley. But looking back, Emily reflected, she wished that she had openly expressed her feelings with her friends, and more importantly, that the friends who noticed her situation and wanted to help actually did so. But the problem she felt was the lack in conversation and proper guidance as to how to go about these situations when seeing not only a friend, but also a family member struggle from opioid use. Stories like Emily's are not uncommon in our society. Every year, about 2 million individuals in the United States suffers from opioid use disorders, which are caused by a variety of opioids, ranging from prescription narcotics to street drugs such as heroin. In Pennsylvania, we are hit particularly hard by this crisis, as we have the 4th highest rate in the country in terms of opioid use disorders. And in Lehigh and Northampton counties alone, there have been more than 1,000 lives lost due to opioid overdoses since 2015. So you're probably wondering, why am I, a high school junior who does not have a loved one experiencing this, talking about the opioid crisis? Well, when I researched the details of this crisis for a debate tournament, one question in particular really struck me. Why hasn't our society been able to resolve an epidemic that has existed in our society for more than 2 decades? Thankfully, many parts of our society, most notably the medical community and law enforcement, have taken significant initiatives to address this crisis in recent years. But the striking observation really prompted me to further research the missing pieces to the puzzle. And what I realized was that while our society has indeed made significant progress in combating this epidemic, we still have not managed to resolve it altogether. And that's because the opioid crisis is a multidimensional issue that affects a large portion of our society, not just individuals with opioid use disorders, but also those who love them. A 2018 study conducted by the American Psychiatric Association concluded that nearly 1 in 3 individuals in the United States know someone with an opioid use disorder. So in order to really solve this crisis then, it is imperative that we tap the potential of a variety of resources. And currently, all of the approaches taken to address this crisis are initiatives taken by adults. We have always had this expectation that such societal dilemmas are solely adult responsibilities. With 72% of people with opioid use disorders ranging between 25 and 55 years old, we have always considered this problem to be an adult problem that only adults can solve. But sometimes that is not enough. There currently exists a disconnect between adults taking these various initiatives and teenagers who witness this issue and want to help, but don't quite know what to do, nor even feel the power of their input. So, what if our society rethought the roles of teenagers and adults in the opioid epidemic, considering teenagers as a resource to help adults combat the crisis? These days, teenagers are armed with substantial information due to technology better connecting our world. And because of that, teenagers are well positioned to act in these situations so long as they have the tools. But the problem is that our society does not yet have all of these tools. From my experiences as a teenager, I've been taught to avoid drugs for obvious reasons. But this way of thinking does not emphasize what exactly teenagers should do to help a friend or a family member seek help to treat an opioid use disorder. When we encounter such situations, then, it is highly unlikely that we know what to do. But there are already many proven instances where teenagers have inspired a change. And I truly believe that it can also be done in this case. When we think of teenagers that have been actively involved in societal crises, we are immediately reminded of figures such as Malala Yousafzai and her advocating for girls' education, and more recently, Greta Thunberg and her climate change activism. There are also collective organizations that are student-led, such as the health and safety organization called Students Against Destructive Decisions, better known as SAD. This organization focuses on a peer-to-peer education to promote safe driving and raise awareness such as mental health and substance abuse. In fact, it is reported that 40 years after the founding of SAD, schools with this chapter have seen a tremendous increase in a positive attitude regarding these issues. And as a result, they feel much safer and are more likely to avoid dangers such as alcohol and driving. So it has been done before. We just haven't yet applied these preventative measures to the opioid crisis. And I don't mean that every teenager has to become an activist or create an organization to make a difference. But what I do believe is that teenagers who simply help their own friends and family members with substance abuse disorders can influence an overall positive change. For example, there were two teenage sisters at a high school in Allentown. They were both honor students who participated in a variety of activities, ranging from academics to interscholastic sports. One of the girls and her parents realized that her sister seemed extremely tired and drowsy, but attested those situations to the rigorous work of high school. What they did not initially realize, however, was that she had a substance use disorder with heroin. Only after an overdose occurred did they realize her condition and jumped into action to help her seek the professional care she needed. Luckily, in this case, she was able to recover after a couple of dangerously close relapses. But the larger significance to the story was the impact on her sister, who helped her mother create a support group in an Allentown church to voice her experiences as the sister who witnessed the opioid use disorder. A major part of her speeches include the values of being supportive and understanding. but she also wishes that she could have better helped her sister at the time had she known what to do. All of these stories share a common theme. There are connections between teenagers and the opioid crisis. In some cases, teenagers miss the opportunity to help, while in other cases, they produced a positive impact. So I strongly feel that it is entirely possible then for teenagers to become the untapped resources for society by helping their families and other loved ones. In fact, some extreme measures have recently been taken to address this crisis from a different perspective. In Carter County, a rural county in the Tennessee-North Carolina border, public health officials in schools have been teaching children as young as 6 years old to administer Narcan, which is the nasal medication used to revive someone from an opioid overdose. This is a powerful example indicating that if these skills are taught correctly, there really aren't any age restrictions to provide help. But in addition to reacting to such situations, it's also important that we're able to prevent such scenarios. So, what would it be like if there was a model for teenagers to become more active in the preventative stage? Currently, many parts of our society, primarily adults of the older generations, still regard drug use disorders as moral issues instead of treatable health conditions. This is a stigma that evokes feelings of fear, shame, and guilt among all of those who experience substance use disorders, whether they are young or old. According to a study conducted by the National Center for Biotechnology Information, only 17.5% of individuals with opioid use disorders reported ever attending or even seeking treatment in the year 2016 due to a fear of societal judgment. Unfortunately, this perception has historically been rooted in our society, making adults feel less inclined to initiate that conversation and try to help those with substance use disorders. But teenagers are just starting to learn about these issues with a fresh lens clear of such stigmatizing perspectives, putting them at a more favorable position to assist a close family member or friend. And we can tell if something is up with a person very close to us. There are many signs, most notably a change in behavior. So you've probably realized by now that I've been using the phrase opioid use disorders instead of the word addiction. And that's because the word addiction has had the negative connotation with stigma. But referring to an individual as someone with an opioid use disorder emphasizes the medical condition itself, rather than the stigma behind it. I also want to be clear that I'm not stating a treatment protocol that has already been proven per se, but based on my conversations with a variety of physicians, leaders of outreach program directors, and other community leaders and experts, these are my ideas that I believe can be successfully implemented. And what I feel is that that next step is to extend our support by initiating conversation. This process includes emphasizing that we are there to listen to his or her story and offer help as needed, and even ask the simple question, is everything all right? Are you okay? Chances exist that the person will not share his or her story right away, but by demonstrating our empathy, we remove these stigmatizing barriers and form an atmosphere in which the person will eventually feel more comfortable sharing his or her story. And once we have initiated that conversation, we can mirror the conversation and ultimately guide the individual to what he or she feels is best. This conversation doesn't revolve around providing instructions such as, you should go receive treatment, or you should go get help, but offering supportive statements such as, based on what you said, what do you feel is the best for you to receive help? Perhaps what we have to do is know enough of the story to offer guidance. We must try our best to detach ourselves from the story and look at it through an objective lens, knowing that our initiative to provide help can certainly produce a positive impact. This is the basis for a variety of community outreach programs that exist today. But the same concepts can also apply specifically to teenagers who want to make a difference when encountering these situations. And if we give this a try, we can see powerful results. I met with another woman who is also currently a certified recovery specialist. She developed an opioid use disorder after using prescription pain medications. Her daughter was a teenager at the time and wanted to help her mother, so she encouraged her to seek the care that she needed. The very fact that it came from her daughter empowered her to enter recovery and ultimately turn her life back around. All of these stories highlight the power of teenagers, and it is the strength of these close relationships that enables these actions to occur. It might seem that this one step of initiating conversation is not much, but collectively, it can certainly impact one's world. And even if one life is saved, that is already a tremendous benefit to society. Thank you.